So this next factor that we will be looking at is gender, and we're looking at how gender affects access to healthcare. So here we're comparing males and females with the statistics, but just keep in mind that gender as a term refers to the characteristics pertaining to and differentiating between masculinity and femininity. And it may also include not only biological sex, but sex-based social structures or gender identity. So a lot of the statistics state that females are actually more likely to access healthcare over their male counterparts. So we're looking at four main reasons for this, or potential reasons. So one is education. The second one is time and priority. So whether or not females versus males spend more time worrying about their health and looking after their bodies. The stigma and stereotypes that still exist. So there's a lot of stereotypes still around today that look at, I guess, a lack of masculinity if you do go to the doctor. So that's still exists. And lastly, the health professional gender availability. So what we mean by this is just what gender the healthcare professional is. A lot of males tend to want to see other males, and there aren't as many male professionals and male GPs around. And same goes for females. A lot of females want to see just female health professionals. So here we're just comparing males and female statistics on access to healthcare. So these were pulled from a couple of reports that are on your fact file, so make sure you have a look. So males and females. So males access 40% of the total Medicare services around, whereas females access 60% of those total services. So you can see that there's a 20% difference in access to the Medicare benefits just from the gender. Males tended to have a smaller proportion of GP consultations and hospitalizations compared to females. 16% of males enrolled with Medicare in 2008 to 2009 and accessed 0% benefits. This lack of access that we can see here from males can be seen to be caused by a lack of male health professionals around, social norms that are attached to seeing a GP or a doctor, and values with traditional views of masculinity. So males tend to ignore preventative health measures as well, according to statistics. 1 in 6 Australian males did not use Medicare services in 2008-2009. By comparison, in 2017 to 18, males claimed 14 Medicare services per person in that year, whereas females, on average, claimed 19 Medicare services per person in that year. So that's quite a difference. Between 2002 and 2006, the rate of avoidable mortality for men was 1.7 times greater than that for women. In contrast to this, we're looking at females. So females access 60% of the total Medicare services, as we said before, as opposed to the 40% that males acquired. So females were 50% more likely to access mental health services provided by GPs, and 57% of females had private health insurance in 2017-2018. 89% of females aged 15 and over reported visiting their GP in the last 12 months between 2017 and 2018. And in that same year bracket, the 2017 to 2018, Australian females claimed over 240 million services through Medicare and received on average 19 Medicare services per person in that year. So that's quite a difference between males and females. A similarity for males and females, so both men and women who have some form of private health insurance sits at a rate of 57%. So that's a fair chunk of the population with that private health insurance. So if you have a look on your poster and PowerPoint, Figure 12, as it's called, was drawn from the Department of Health and Human Services report. So this graph that we can see is of community health registered clients by age and categorised by age group and sex in Victoria between 2013 to 2014. So this graph to the left represents the overwhelming statistics that females across the majority of the lifespan are more likely to attend registered community health clinics between 2013 and 2014 in Victoria. Over 5,000 more females were noted to attend a registered clinic aged between 60 and 69. Over 3,000 more female registered clients were recorded for the ages of 40 to 49 compared to male counterparts. Almost double the registered health clients between the age of 20 to 29 were females. Registered clients of age 80 plus were just less than 1/3 greater in females than males. So as you can see from this graph, the grey being females and the blue being males, there is a significant difference and increase in the female rates to be registered clients within community health than male counterparts. So you can just tell by looking at this graph that there is a significant gender gap and gender difference in access to healthcare. So this next graph, figure 6, looks at the rates of avoidable mortality by gender and also looks at the socioeconomic advantages and disadvantages within both females and males. So as you can see, there are two male columns and two female columns. So we're looking at males most disadvantaged and males least disadvantaged, and then females most disadvantaged and females least disadvantaged. So as we can tell by this graph, overall, men in the lowest socioeconomic group have far higher rates of avoidable mortality than men and women in all other socioeconomic groups. Although men in the highest socioeconomic group fare better than men in the lowest, they still have higher rates of avoidable mortality than women in all socioeconomic groups.